Well, usually when we report a story involving a doctor, many times it's because he or she has saved a life. But this story is the other way around. The Biden administration has made cancer treatment and research a priority now. Our Brittany Moncrief shows us how a clinical trial in Tennessee helped save a retired Memphis dentist's life who fought bladder cancer.
I just want to share that personal moment with you.
Family means the world to Dr. Irv Cherny.
Which one are you? I still have trouble figuring out who's who.
He takes pride in being a retired dentist, husband, father, and grandfather. It's these roles that got him through one of the biggest battles yet.
In 2016, I was in the Germantown half marathon, and after I finished the race, came home, I noticed some blood in my urine.
He thought it was a side effect from all the running until it happened again and again that same year.
Thanksgiving Day, I woke up that morning as usual, but I couldn't pass urine that day for whatever reason.
Dr. Cherny was admitted to the hospital, and shortly after tests, a urologist found troubling symptoms.
He said, I think you have some tumors in your bladder.
Dr. Cherny immediately had surgery to remove the tumors.
That evening came back and said, I'm afraid to tell you, you have cancer of the bladder. The word cancer is probably the scariest word that anybody can hear.
And no matter the treatment, surgeries, or medications, the tumors kept coming back. That was until one of Dr. Cherny's dental patients told him about Dr. Chang at Vanderbilt University Medical Center and his clinical trials.
The recommendation for these patients is actually to have their bladder removed, which is a very big operation.
It's so complicated, the average hospital in the U.S. does about one bladder removal a year. Luckily for Cherny, Dr. Chang and his nurse Bree Duncan got him enrolled in their clinical bladder cancer trial.
This is a trial that uses a medication, a combination of actually treatments that are put into the bladder. By putting the medicine into the bladder actually pumps up its own immune system to fight the cancer within the bladder.
Dr. Chang used a blue light cystoscopy to locate even the smallest of tumors, remove them, and gave Cherny the medication combination.
I probably had 8 to 10 to 12 surgeries over all these years, but over the past 2 years, almost 2.5 years, no surgeries because the drug began to work.
Cherny is now tumor-free.
You get to see him with his family and hear all the stories that he gets to keep living his life.
The ultimate reward.
Family's the best thing there is. There's nothing better. Nothing can replace that.
In Cordova, I'm Brittany Moncrief.